let's start the video with Dr. Bhattacharya.
Welcome, everybody. My name is Professor Jay Bhattacharya. I'm a professor of medicine at Stanford University, and I'm pleased to be able to offer an alternative to the lockdown-focused policies that we have followed throughout the pandemic. Those policies have not worked to stop the pandemic and have led to the deaths of hundreds of thousands of people in the United States and have created destruction and misery almost everywhere they've been tried. As an alternative, I would suggest a plan that I authored with Sunetra Gupta, a professor of epidemiology at Oxford University, and Martin Kulldorff, a professor of epidemiology and biostatistics at Harvard University in October of 2020. The basic outlines of that plan would work not just in this pandemic, but in many, many other pandemics. The plan relies on two basic scientific facts, completely undisputed. First, that is that this pandemic, the disease in this pandemic, the virus in this pandemic, is not an equal opportunity virus. In fact, it harms people who are older at much higher rates than people who are younger. A 1,000-fold difference in the risk of mortality and severe disease from infection in this pandemic. A very large fraction of the population who have died from this virus are over the age of 65, and almost 40% of the deaths in the United States that have occurred in nursing home settings where older people with many comorbidities reside. The second scientific fact is that the lockdowns themselves are harmful to population health. The lockdowns have created a crisis in the mental health of the population in the United States and elsewhere. In July of 2020, after only a short amount of lockdown, 1 in 4 young adults in the United States reported seriously considering suicide. It's also affected physical health. For instance, people who were, many people skipped cancer screening, many people skipped even treatment for heart attacks and diabetes. All of these effects on the use of preventive medical services will have long-term consequences on the health of the population. On children, the lockdown in many, many states led to extended time away from school. And we know from an extensive literature that this leads to enormous damage to the health, long-term health, wealth, and well-being of children. Especially poor children were affected by this. So if you put these two facts together, what you have is a vulnerable population, an older vulnerable population who really did need protecting from the virus because they face such a high risk of death if we're infected. At the same time, the rest of the population were harmed more by the lockdowns than they were by the virus itself. The Great Barrington Declaration, co-authored with Martin Kulldorff and Sunetra Gupta, then proposed to protect the vulnerable through a policy of focused protection, including a suite of strategies to protect older people living in nursing homes and older people and other vulnerable people living in the community at large. The lockdowns needed to be lifted then, and the continuing restrictions on populations need to be restricted now because they impose more harm than good. They do not stop the disease from spreading, as we can see during this current wave. The disease spreads via regional and seasonal patterns. We've maintained this illusion of control over the path of this disease and attributed to basically regional and seasonal influences to our own actions, which actually have not particularly affected the path of the disease, while at the same time wreaked enormous harm on the population at large. So lift the lockdowns and engage in extensive focused protection of vulnerable populations. We wrote that in October of 2020. Now we have even better tools to protect vulnerable populations than we did then. The vaccines, while they do not stop disease spread, actually are quite good against severe disease. Making sure that vulnerable older populations are vaccinated and protected against severe disease is still quite important, not just in the United States, but around the world. Furthermore, we have better treatments and we should be investing in research to continue to improve our treatments and strategies to make sure that we have treatments available everywhere where someone vulnerable especially gets sick. So if you put these strategies together, our society can continue to function in a much more healthy way than we have functioned these past 2 years, while at the same time working to protect older people. The strategies we followed, basically by ignoring the possibility of early treatment, by not focusing our efforts on the protection of vulnerable populations, and worst of all, these restrictions on human behavior, on human connection, have wreaked enormous damage. And it's far past time that we stop those policies and instead followed an alternate plan. Thank you for your time.
So Dr. Bhattacharya was joined by colleagues from Harvard and from Oxford and put together the Great Barrington Declaration. I'm pretty sure they published that in, I think it was October 2020. We've since seen emails between Dr. Collins and Dr. Fauci, head of NIH and NIAID, basically with a concerted effort to reputationally destroy Dr. Bhattacharya and his co-authors. Now, I'll ask the listening audience, does that sound like a crazy individual? Sounds to me like a highly qualified, very reasonable person, as we've assembled in this room.